Hi, I'm Dr. Chelsia Kennedy-Snodgrass, and I'm a specialist in pulmonary and critical care medicine at Summa Health. Today, I'll give you an overview of CT and PET scans. We'll talk about what they are, what they can be used for, and what you can expect on the day of your procedure. Both a CT and PET scan can be used to do the following. They can evaluate an indeterminate lesion and guide decisions about what areas to biopsy for diagnosis. If a patient is found to have cancer on a biopsy, they can be used to establish a baseline of staging before commencing treatment. After starting treatment, they can be used to assess response to therapy. And long-term, they can monitor residual disease or for disease recurrence. So let's start by talking about CT scans. CT scan, which stands for computed tomography scan, or also known as a CAT scan, is a special type of imaging procedure that produces a detailed 3D image of the inside of your body. This type of scan is often prescribed to check for abnormalities in the brain, spine, neck, chest, or abdomen. By looking at CT scan images, your doctor can evaluate hard tissues, such as your bones, and soft tissues, such as your muscles and organs. This means a CT scan will show everything from bone fractures to tumors. What can you expect when having a CT scan at Summa Health? To undergo a CT scan, you will need to lie flat on an exam table. The table will then move through the CT scanner as it takes images. The scanning process usually only takes a few minutes. Some scans require either oral or IV contrast, so you may need to drink a contrast material before the scan or receive it intravenously. The contrast is a type of dye that highlights the areas being examined so doctors can see them more clearly. Overall, CT scans are a simple, painless procedure which can be performed quickly. Next, let's talk about PET scans. PET, which stands for positron emission tomography scan, is a form of nuclear medicine imaging. A PET scan is a safe procedure, using only a tiny amount of radioactive material called a radiotracer, which is detected by the scanner to create images of the inside of your body. A PET scan shows a doctor if abnormal tissues are growing too quickly. Now that you know what a PET scan is, let's talk about what you can expect when having a PET scan at Summa Health. At the beginning of a PET scan procedure, a technologist will place an IV on the inside of your elbow. They will inject a small amount of the radioactive tracer into one of your veins. After the injection, the tracer will move through the body and gather in tissues and organs. You will have to wait about an hour for your body to absorb the tracer before being scanned. Tracers will collect in inflamed areas or cancer cells for doctors to see. After the tracer is absorbed, you will move to an exam table that slides into a scanner. The PET scanner will detect the tracer and turn the data into 3D images on a computer monitor. A PET scan will take a little longer than a regular CT scan, usually about 45 minutes. Both CT and PET scans are relatively easy and quick. I hope you're feeling more comfortable and have the necessary knowledge when preparing for a CT or PET scan. For more information, please call the pulmonary team at 330-319-9700.